According to the Journal of Clinical Endocrinology and Metabolism, women lose up to 30% of their skin's collagen within the first 5 years following menopause. This loss significantly affects skin elasticity, firmness, and structural integrity. Collagen serves as a foundational protein for maintaining the appearance and function of skin, joints, and connective tissues. A 30% reduction in a 5-year period represents a rapid biological transition that is often misattributed solely to chronological aging. This phenomenon corresponds with the postmenopausal phase, during which estrogen levels decline sharply. Estrogen plays a vital role in stimulating collagen synthesis, regulating skin hydration, and maintaining bone mineral density. Despite the presence of regular menstrual cycles in some women after age 50, serum estrogen levels may still remain insufficient to support optimal tissue function. At the same time, other age-related shifts begin to accelerate. These include bone resorption, redistribution of facial fat pads, and declines in muscle mass and skin lipid production. Collectively, these factors contribute to observable external aging and internal structural changes. Strategies that may have been effective prior to menopause, such as conventional skincare routines, general fitness regimens, and basic dietary supplementation, are often inadequate in addressing the compounded biological needs during late midlife. However, multiple peer-reviewed studies now point toward 5 critical areas of intervention that can help preserve physiological function and visible vitality beyond age 55. These include targeted hormonal support, musculoskeletal preservation, dermal fat maintenance, science-based skincare, and metabolic adaptation. This presentation outlines each of these 5 interventions, drawing upon recent clinical data, biochemical insights, and non-surgical solutions currently supported by the literature. Postmenopause is clinically defined as the stage that begins 12 consecutive months after a woman's final menstrual period. This phase is characterized by sustained estrogen deficiency, even in individuals who may still experience irregular or occasional bleeding due to hormone fluctuations or medical interventions. Contrary to common belief, the presence of menstrual cycles is not a reliable indicator of sufficient estrogen levels. According to the North American Menopause Society, NMS, estrogen production can drop to less than 10% of premenopausal levels, even in women who report ongoing cycles. This leads to systemic biological changes that affect multiple organ systems, particularly skin, bone, muscle, and mood regulation. 3 primary sex hormones are significantly impacted. 1. Estrogen, estradiol, E2. Estrogen plays a central role in collagen production, influencing skin elasticity and thickness, bone mineral density, protecting against osteoporosis, water retention and lipid metabolism, which affect skin hydration and texture. Data from a Journal of Investigative Dermatology shows a direct correlation between declining estrogen and dermal atrophy, reduced sebum production, and increased wrinkle formation. 2. Testosterone. Though typically discussed in the context of male health, testosterone contributes to muscle tone, energy, and facial structural integrity in women. Declining testosterone postmenopause is associated with reduced lean body mass, facial hollowing, and decreased libido. 3. Progesterone. Progesterone supports deep sleep, mood stability, and skin regeneration. Lower progesterone levels correlate with disrupted sleep cycles, heightened cortisol response, and slower repair of skin tissues. These effects can accelerate both perceived and biological aging. Without targeted support, these hormonal shifts contribute to accelerated bone loss, estimated at 1 to 3% per year postmenopause and age, skin thinning and wrinkling due to reduced collagen and hydration, muscle loss, sarcopenia, which further contributes to fatigue and reduced mobility. This hormonal cascade not only alters external appearance, but also impairs internal physiological resilience. Early intervention, whether through nutritional, hormonal, or lifestyle strategies, can significantly slow or even reverse many of these aging pathways. In subsequent sections, evidence-based solutions will be outlined to address each of these biological changes. Step 1. Hormone support. Hormonal decline is considered one of the most significant contributors to accelerated aging in postmenopausal women. Supporting hormone balance through evidence-based interventions may help mitigate visible aging, improve mood and energy, and restore skin quality and structural integrity. A comprehensive evaluation should begin with targeted blood testing. The following biomarkers are recommended to assess the status of key hormones and endocrine function. Recommended hormone blood panel. Estradiol, E2 reflects active estrogen levels. Free and total testosterone, assesses androgen availability. Progesterone, regulates mood, sleep, and skin renewal. DHES, dihydroepiandrosterone sulfate, a precursor to both estrogen and testosterone. Full thyroid panel, including TSH, free T3, free T4, and reverse T3, to detect metabolic dysfunction. These results offer insight into whether a candidate may benefit from bioidentical hormone replacement therapy, or BHRT. BHRT uses compounds structurally identical to endogenous human hormones and is available in various delivery systems, such as transdermal creams, patches, sublingual lozenges, or implanted pellets. Clinical data suggests that transdermal estrogen, in particular, is associated with fewer thromboembolic risks compared to oral formulations. Additionally, topical estrogen applied directly to the face has shown promise in increasing collagen density and improving skin hydration without systemic side effects. A 2021 review in Dermatologic Therapy confirmed that facial estrogen creams can stimulate fibroblast activity and improve dermal elasticity. Case example: Cynthia, age 58, presented with persistent skin dryness, poor sleep, and low libido. Laboratory results revealed suboptimal progesterone and estradiol levels. A low-dose bioidentical progesterone capsule was prescribed alongside a topical estradiol cream. Within 6 weeks, Cynthia reported improved sleep quality, enhanced skin suppleness, and a return in overall vitality. While BHRT has shown benefit in symptom relief and biological rejuvenation, individualized risk assessment is essential. Hormone therapy is contraindicated in individuals with a history of hormone-sensitive cancers, blood clotting disorders, or uncontrolled hypertension. Shared decision-making with a licensed provider is strongly advised. Non-hormonal options such as phytoestrogens, topical peptides, and estrogen receptor modulators may be explored in cases where BHRT is not appropriate. Restoring hormonal harmony is not solely about aesthetics. It directly influences bone density, sleep architecture, and emotional resilience. When medically appropriate and carefully monitored, hormonal support can serve as the foundation for reversing the most rapid declines experienced after age 55. Step 2. Bone and structure preservation. Bone density loss is commonly associated with increased fracture risk in aging populations, but its effects on facial structure are often overlooked. Emerging research confirms that diminished skeletal volume contributes not only to physical frailty, but also to visible signs of facial aging, including sagging in the jawline, mid-face, and temple regions. The human face relies on the underlying facial bones for structural support. As bone mass declines, the scaffolding that holds the skin, fat pads, and muscles in place begins to recede. This can result in hollow temples, jowl formation, and deepening nasolabial folds. These changes are often misattributed solely to fat loss or skin laxity, but underlying bone deterioration plays a critical role. Bone density begins to decline more rapidly after menopause due to estrogen deficiency. According to data published in Osteoporosis International, postmenopausal women lose approximately 1 to 3% of bone mass per year. However, most clinical screenings for osteoporosis do not occur until age 65, by which point significant bone loss may have already occurred. Early detection is possible with a DEXA, dual energy X-ray absorptiometry, scan, which measures bone mineral density and provides a detailed assessment of fracture risk. The scan is quick, non-invasive, and delivers less radiation than a cross-country flight. It is recommended that women consider obtaining a baseline DEXA scan between the ages of 50 and 55, especially if there's a family history of osteoporosis or early menopause. In addition to weight-bearing exercise, several micronutrients have been shown to support skeletal integrity. Vitamin K2 and vitamin D3 help direct calcium into bones and away from arteries. Collagen peptides, especially types I and III, provide structural proteins essential for both bone and skin. Silica supports collagen synthesis and improves bone mineralization. Case example: Martha, age 60, had noticed a subtle change in her jawline and facial shape, but attributed it to normal aging. A routine DEXA scan revealed early-stage osteopenia. She began a resistance training program and introduced a daily K2, D3 supplement alongside marine collagen peptides. Within 6 months, her posture improved, her jawline regained definition, and she reported a significant increase in confidence. Preserving bone is not only essential for preventing fractures, but also for maintaining facial structure and appearance. Integrating diagnostics with lifestyle and nutritional support provides a foundational step in any postmenopausal rejuvenation protocol. Step 3. Protect facial fat pads. Facial aging is not solely a function of skin laxity. Structural volume loss, particularly in the facial fat pads, plays a critical role in the progressive changes observed after midlife. Fat pads are not inert. They function as active endocrine tissues with high aromatase activity, enabling local conversion of androgens to estrogens. This makes them a localized estrogen reservoir that contributes to the maintenance of skin tone, hydration, and collagen synthesis. After the age of 55, hormonal shifts, especially sustained low estrogen and testosterone, reduce fat pad volume and impair tissue regeneration. As these pads shrink or descend, the overlying skin loses its support. This leads to visible changes such as under-eye hollows, temple wasting, cheek deflation, and jawline sagging. The resulting facial shape often appears more angular or squared, contributing to a more masculinized appearance in many women during postmenopause. In addition, excessive cardiovascular exercise has been associated with further loss of subcutaneous facial fat, especially when combined with caloric restriction or rapid weight loss. While cardiovascular fitness remains important, overtraining without resistance support may accelerate volume loss in the midface. Non-surgical regenerative therapies have emerged as viable interventions. Platelet-rich fibrin, PRF, is an autologous injectable derived from the patient's own blood, containing fibrin matrix, growth factors, and regenerative peptides. Unlike synthetic fillers, PRF stimulates collagen production and encourages natural fat regeneration over time. It carries no risk of immune rejection or foreign body reaction. Sculptra, a polylactic acid biostimulator, also promotes collagen synthesis, but is synthetic in nature. Traditional dermal fillers, e.g., hyaluronic acid, provide immediate volume but do not contribute to long-term tissue remodeling. Comparative studies indicate that PRF offers more natural integration, while Sculptra may be preferred for large volume correction over multiple sessions. In clinical practice, aesthetic outcomes are more favorable when the goal is structural restoration rather than superficial volume inflation. Overfilling can distort natural contours and produce an artificial appearance. Emphasis on foundational support, rather than masking deficiencies, aligns better with long-term rejuvenation goals. Preservation and regeneration of facial fat pads represent a key strategy in slowing age-related facial changes. This step complements hormonal support and skeletal integrity to maintain youthful proportions and facial harmony. Step 4. Advanced skincare that actually works. After the age of 55, intrinsic aging is compounded by a sharp decline in estrogen, collagen production, and epidermal regeneration. To address these biological shifts, skincare interventions must move beyond cosmetic marketing and focus on clinically validated ingredients and protocols. One of the most effective antioxidants for photoage skin is tetrahexyldecyl ascorbate, THD ascorbate, a stable, lipid-soluble form of vitamin C. Unlike traditional L-ascorbic acid, THD ascorbate penetrates the dermis more effectively and remains stable in formulations over time. It helps neutralize free radicals, support collagen synthesis, and reduce pigmentation with minimal irritation. For cell turnover and dermal remodeling, retinaldehyde is preferred over over-the-counter retinol due to its higher potency and lower risk of inflammation. Applied 2 to 3 times per week at night, retinaldehyde stimulates collagen production, smooths texture, and reduces fine lines. When alternated with glycolic acid peel pads, mild but consistent exfoliation is achieved, promoting epidermal renewal and improved skin luminosity. Adjunct therapies, such as dermarolling with microneedling devices, can enhance the absorption of peptides and growth factors. Studies have shown that skin needling performed at home using short needle lengths, 0.2 to 0.3 millimeters, can improve product penetration without significant downtime. Low-level light therapy, LLT, using red or near-infrared LED masks is another evidence-supported intervention. A 2014 randomized trial published in the British Journal of Dermatology demonstrated statistically significant improvements in skin elasticity, collagen density, and wrinkle depth in subjects treated with LED light over 12 weeks. These effects are attributed to photobiomodulation, which activates mitochondrial function and upregulates fibroblast activity. Caution is advised when selecting home-use RF, radiofrequency, devices, as their efficacy varies widely. While clinical-grade RF treatments have shown results in controlled settings, many consumer devices lack sufficient energy output to produce measurable changes in skin tightening. Furthermore, unregulated heat application may degrade collagen if not used properly. Joanne, age 62, had been using a conventional vitamin C serum with limited results. After switching to a THD ascorbate formulation and incorporating LED light therapy twice per week, she observed visible skin improvements. Her peers assumed she had undergone in-office procedures, although her routine remained entirely at home. When used in a structured and evidence-informed routine, targeted skincare can complement internal interventions by addressing surface-level aging. At this stage of life, performance matters more than marketing. Selecting ingredients and tools with clinical backing is essential for sustainable, visible results. Step 5. Nutrition and metabolic reset. After age 55, significant metabolic changes occur that influence skin appearance, fat distribution, and muscle preservation. Declining estrogen contributes to reduced insulin sensitivity, increased visceral fat accumulation, and dehydration at the cellular level. Adjusting nutrition to match these shifts is essential for maintaining both internal health and external vitality. Protein intake becomes a critical factor in combating sarcopenia, or age-related muscle loss. Research suggests that women over 55 require approximately 100 to 120 grams of protein per day, or roughly 2 grams per kilogram of body weight, to maintain lean muscle mass and support structural integrity. Inadequate protein not only compromises physical strength, but can also result in visible facial hollowing due to muscle degradation in the cheeks and jawline. A synergistic supplement combination includes creatine and collagen peptides. Creatine supports muscular energy and recovery, while hydrolyzed collagen peptides, particularly types I and III, aid in skin elasticity, dermal hydration, and joint support. Emerging studies also point to creatine's role in supporting cognitive function during aging. Hydration is often underestimated. With declining aldosterone and estrogen levels, fluid and mineral balance becomes disrupted, leading to drier skin and impaired thermoregulation. Rather than relying on plain water, electrolyte-enhanced hydration, containing sodium, potassium, and magnesium, is more effective in maintaining cellular water retention and skin plumpness. Healthy fats play a dual role by supporting hormone production and improving skin barrier function. Sources such as cold-pressed olive oil, avocado, walnuts, and wild-caught salmon provide omega-3 3 fatty acids, and anti-inflammatory compounds essential for lipid balance and dermal resilience. In contrast, refined sugar and high glycemic carbohydrates accelerate skin aging through glycation. This process damages collagen fibers, making them rigid and less elastic. A study published in the American Journal of Clinical Nutrition found that higher dietary glycemic load was associated with poorer skin elasticity and increased wrinkle depth. Carolyn, age 67, had not changed her skincare routine in years, but noticed a gradual decline in skin firmness and increased cravings. Upon switching to a protein and fat-rich breakfast, including eggs, avocado, and greens, she reported more stable energy, improved sleep, and visible enhancement in facial contour, particularly around her cheeks. Targeted nutrition, when aligned with postmenopausal physiology, reinforces the outcomes of hormonal, skeletal, and topical interventions. Together, they form a comprehensive strategy for sustaining health and appearance well into later life. In the pursuit of facial rejuvenation, injectable and surgical interventions are often perceived as quick solutions. However, it is important to understand their mechanisms and limitations. Botulinum toxin, Botox, functions by temporarily inhibiting muscle movement. While it reduces the appearance of dynamic wrinkles, it does not stimulate collagen production or improve skin quality. Its effects are superficial and limited to expression lines. Dermal fillers, typically composed of hyaluronic acid, restore temporary volume in targeted areas such as the cheeks, lips, and under the eyes. However, they do not lift tissue or reverse underlying structural decline. In excess, fillers may distort facial proportions and create an unnatural appearance. Sculptra, polylactic acid, and platelet-rich fibrin, PRF, represent longer-term solutions by stimulating endogenous collagen production. These treatments offer gradual improvement in skin texture and volume by enhancing tissue regeneration from within. A facelift remains a valid surgical option for addressing advanced skin laxity and excess tissue. However, it does not correct pigmentation, volume loss, or skin texture, and is often complemented by non-surgical treatments post-operatively. The cost ranges between $40,000 and $200,000 in the United States, depending on region and surgical complexity. It is also important to note that overfilling does not equal youth. Youthful appearance is defined by proportional structure, skin tone, and expression, not volume alone. Long-term rejuvenation outcomes are most successful when structural preservation is prioritized over aesthetic inflation. Looking younger after age 55 is not about following trends. It is about aligning with the body's biology. When aging is approached through science, rather than marketing, the path forward becomes clear. To review, 5 foundational shifts support visible and functional rejuvenation. 1. Hormonal support to rebalance estrogen, testosterone, and progesterone levels. 2. Bone density preservation through early screening and targeted supplementation. 3. Facial fat pad protection to maintain natural contours and estrogenic support. 4. Advanced skincare based on stable actives and clinically proven tools. 5. Metabolic nutrition to support hydration, collagen, and muscle integrity. Together, these interventions form a holistic strategy for aging well, internally and externally. The goal is not to look 30, but to feel strong, confident, and vibrant at 60, 70, and beyond. For those exploring these changes, small adjustments can create compounding benefits over time. Appearance, energy, and function are interconnected, and all 3 are responsive to informed choices. To continue this journey, consider subscribing for the next episode. How to rebuild your face naturally using massage, light, and diet. Comment below with your age and experience. What has worked or not worked for you so far? Your story may help others in this community. Aging is inevitable, but how you age, how you adapt and thrive, is a choice.